Hello all. So today it's the last section for paraplegia and today we'll study how to write a diagnosis for paraplegia. Okay. So now coming to how to write a diagnosis. First of all we have to include its neurological. What's the paralysis? That is it's a paraplegia. It's a paraplegia or it may be a paraparesis. It can be a paraparesis. Okay. Next, we have to locate where is the site of the lesion. We have to locate the site of the lesion. It can be at the brain, it can be at the spinal cord, it can be at the level of the nerves, it can be at the muscles. Okay, so it can be at the brain, spinal cord, nerve and muscle. If we get a spinal cord cause, then we have to find whether it is a compressive cause or a non-compressive cause, whether it is an extramedullary or intramedullary, whether it is extradural or intradural. So if we get a spinal cord cause, then we have to locate the lesion and with this level of the lesion have to be find out, and we have to find whether it is a compressive cause or a non-compressive cause, extramedullary or intramedullary, intradural or extradural. So how to differentiate, this all I have discussed in the last session on. So you can revise it there. Next we have to find other location may be at the level of the muscle, at the level of the nerves, neuropathies, and at the level of the muscles, any myopathies. Okay. Next we have to find the pathologically. It can be a spastic paraplegia or a flaccid paraplegia. The spastic paraplegia come under UMN type and flaccid paraplegia that comes under LMN type. Then it can be an etiological. Then we have to find the etiology. That can be tumor, trauma, inflammatory, vascular, or okay, it can be tumor, trauma, inflammatory, or vascular. So these things, these four things must be included in your diagnosis. Okay. Next, I will give an example. With this simple example, we can look, we can diagnose it or not. How to write a diagnosis can be studied. Okay, now here it is given. There is weakness of both lower limbs. There is upper and mid abdominal reflexes are present. Lower abdominal reflex is absent. Cremastic reflex, knee jerk, ankle jerk all are exaggerated. There is extensor type of plantar response. Root pain is present. There is early loss of position sense and there is sacral loss. There is late bowel and bladder involvement and there is history of trauma. Okay. Now, there is weakness of both lower limbs. What did it indicate? Yes, it's a paraplegia. Okay. Now, it's given upper and mid abdominal reflex is present. And there is lower abdominal reflex that is absent. And there is cremastic reflex, knee jerk, ankle jerk. They are all are exaggerated. And extensor plantar response. From this, I think it may be a spinal cord cause. This is given for to find there is a distinct level is there. So most probably it may be a spinal cord cause. Okay. And there's a root pain is present. If it is a spinal cord cause, we have to find the level of the lesion and whether it is a compressive or a non-compressive cause. As a root pain is present, it is most probably a compressive cause. And here it is given, there is early loss of position sense and sacral loss and there is late bowel and bladder movement. These two indicate that it is an extramedullary, extradural cause. It is an extramedullary, extradural cause. And there is history of trauma also. And from these reflexes, we can find the level of the lesion. We can find the level of the lesion. As we know that upper and mid abdominal reflex is present and their root is upper reflex up T7 to T9 and mid from T9 to T10. So up to T10 everything is normal. So the problem is below T10. So the problem is below T10. And lower abdominal reflex is absent. Absent means it's an element type. It's an element type at the, we already know that it is element type at the level of the lesion and below the level it will be a UMN type. Okay. So the lower T11 to T12 everything root is lower abdominal reflex. So the level of the lesion is at the T11 to T12. Okay. And here the lower abdominal and below that this lesion, that is cremastic reflex, knee jerk, ankle jerk, they all are exaggerated. These all are exaggerated. So we know that below the level of lesion we have a UMN type of lesion. Okay. And as the root pain is present, this is a compressive cause, and there is early sacral loss, and there is early loss of position sense. All this is an extramedullary extradural cause, and there is also history of trauma. Now we can look how to write the diagnosis. So this is a paraplegia, and the site is at the level of the spinal cord, and where it is the level may be as a lower abdominal reflex is absent, it is at the, and the cremastic reflex, they all are exaggerated, the level may be at the T11 to T12, and it is a compressive cause, and it is extramedullary extradural. And it's a flaccid paraplegia. At the level of the lesion, it is the element type, so it's a flaccid paraplegia. And the etiology there is given, there is an history of trauma, and the etiology is most probably a trauma. So this is the way, these whole things should be included in your diagnosis. Okay, so this is some basic things about paraplegia. With these simple things, it's enough as a basics. Then you can read more about paraplegia. This will